So, how should healthcare provision be regulated? This is different from how health insurance is regulated because we're talking about the actual doctors and hospitals. So, there are different problems in private healthcare markets. You end up with oligopoly pricing, monopoly rents for doctors and specialists who set their supply very low. Um, Too much competition can lead to medical arms races and also physician induced demand. So, what kinds of policies can combat these issues without creating their own problems that potentially are even worse? So, how should healthcare provision be regulated? We have three basic options. One is just completely public provision, another is fully private, and finally, government of changing prices. Those are our three options. So when we talk about public provision, this would be in the UK, but not in Canada. Um, Under public provision, hospitals are fully government run. They're financed by taxes, and the physicians are directly employed by the government. So physicians are public workers, public sector workers. By contrast, in Canada, while they do have universal coverage and single payer coverage, physicians are private and they just contract with the government to receive their fees. But under public provisioning of healthcare, the government owns the hospitals and directly employs physicians and care providers. This can reduce costs by banishing oligopoly power and reducing medical arms races. Some might suggest, though, that a nationalized system can be less efficient than private markets. Government workers could have less of an incentive than private workers to ensure the success of their hospital. It could have less clear feedback mechanisms to correct the ones that are not succeeding. So the CEO won't necessarily have a strong incentive to make sure that each of their, let's say, revenue streams or departments of the hospital are, providing the highest quality care that they should be. Empirically, we do find that countries with these kinds of nationalized healthcare systems seem to be the best at controlling their healthcare costs. But there is a charge among members of the public internationally that they could offer lower quality healthcare. Specifically, if you look at countries that have fully public hospitals, they tend to have longer wait times. Although, on average, overall, the wait times seem to be, at least in the case of the United Kingdom, under control. Option 2, private provisioning. In this case, you're allowing for competition to do the work of setting incentives for how people are going to operate. In private markets, if you have too little competition, of course, you can have market power. If you have a really high HHI, Herfindahl index, you can have high prices and under-provisioning under a monopoly system. Also, at the same time, too much competition can exacerbate inefficient quality competition, leading to things that we've talked about, like the medical arms race, which can, in the end, increase healthcare costs. So there's definitely a trade-off within the private provisioning system. Another concern with private provisioning is that some populations will be left out of that market, like the poor and uninsured. So one way of addressing that is to offer tax breaks to hospitals, like nonprofit hospitals, for example, don't have to pay taxes. Traditionally, they tend to care for a greater share of the poor, those vulnerable to being left out of the medical care system. Most developed countries require hospitals to provide emergency care, regardless of their ability to pay. So in the US, that law is called EMTALA, the Emergency Medical Treatment and Labor Act of 1986. So these last resort kinds of laws, they promote equity by at least making sure that everyone can see an emergency care physician if they absolutely need to, but it can impose costs to society as a whole. We could have just had those people seeing a primary care physician. It would be a lot less expensive to treat them from the beginning. And it can build up a lot of just kind of people, a lot of crowd in emergency rooms and trauma centers. So these are issues with private provisioning of medical care. And option 3 is government set prices. So this is design that is trying to have both the competition of the private market, but without the price setting issues that can result from the oligopolies or the market power problems that can lead to like high prices. So basically, in this case, you keep the providers private, but you prevent them from exercising their market power by giving the government the power to set prices. And that in turn should keep healthcare affordable with these price controls that keep costs down. It should help to do that, but the government could set prices in a way that ends up inducing some perverse incentives. So the prices have to be set properly. If treatments are priced below their cost, then physicians and hospitals are going to have no reason to ever do those treatments because they're not going to be able to recoup their costs on those treatments. So you kind of have to find a way to make the price, high enough that it's reimbursing their costs, but not so high that it's too profitable to where people are just going to tell people to where hospitals and physicians might just be over prescribing that one particular thing just so they can get a lot of profit off of it. And it's going to be hard for the government to know exactly what that break-even cost would be for the provider. So those are the 3 ways of addressing healthcare provisioning. And in the last video coming up, we'll compare the way that different countries have incorporated all of those questions.